Welcome to the Aesthetic Dental Spa podcast. We provide information about your oral health. Our dentist's expertise has helped thousands of patients in the New York City area for over 15 years. Dr. Arvind Philomen and Dr. Divya Adusumilli are dedicated to learning the latest techniques and advancing treatment methods in their field.
In this episode, our Washington Heights dentists break down the differences between various teeth restoration treatments. You may be asking yourself, what's the best way to restore a white and healthy smile? It seems like there are so many choices out there. You do some research and find that you can possibly pick from veneers versus implants versus crowns versus bridges. But what can you do in terms of understanding the differences? Fortunately, you can learn from a Washington Heights dentist's breakdown on teeth restoration treatments. First of all, let's understand what are tooth veneers. Veneers are a great option for people with chipped or stained teeth. The veneer is a thin piece of porcelain that is shaped like a natural tooth and covers the other tooth. The dentist takes a thin layer of enamel off first and then applies a super strong bonding cement to keep the veneer on. The veneer is colored to match the patient's other teeth and can give a natural-looking smile. Getting veneers typically requires 3 visits, one for the consultation, one for the fitting and placement of temporary veneers, and one for the final veneer application. This is not something that people should take lightly, since it cannot be reversed. The veneers can last over 10 years with proper care before needing to be replaced. There's an extra cost for fast turnaround. Now, let's review what is a dental implant. A dental implant is a replacement tooth that acts like a natural one. Once placed, dental implants do not need to be removed daily. This is becoming a common procedure, and patients are liking that they don't have to do extra maintenance. These are also durable, lasting upward of 25 years with proper care, whereas dentures are often replaced after 10 years. The dental implant process is a fairly long one. First, the dentist cleans out the area and inserts a titanium screw into the jawbone. The screw and the jawbone fuse together in a process called osseointegration, and that can take several weeks. Then, the dentist puts an abutment over the screw and then finally a crown on top of that. Afterward, the patient only needs to maintain regular oral hygiene and visit the dentist for biannual checkups. Next, let's explore what are tooth crowns. There are a variety of materials that can be used for dental crowns. Crowns can be made from various materials, including gold, porcelain, and zirconia. The choice depends on the tooth's location, as bite force is stronger in the back of the mouth than in the front. Budget and what the patient can afford to pay play a part. Aesthetics can also be taken into consideration. While crowns are used in the above-mentioned dental implant process, they are also used to protect teeth after root canals, since the tooth is dead, and it can also cover a tooth that has a cavity that is too large for a dental filling. A dentist may use it to provide protection for a cracked tooth as well. Finally, what are dental bridges? Dental bridges are a viable option for individuals with persistent gum disease who may not be candidates for implants. Dental implants require excellent oral health, and dental bridges can help those who might not meet those requirements. They can also serve better for those who don't want the extra work of having to take dentures out every night and soaking them. When someone gets a dental bridge, they are getting a replacement tooth that has a crown on each side. The crowns go over the healthy teeth that are next to the gap. Surgery is not required, but the dentist may have to remove parts of the healthy teeth to make room for the replacement one, and have the crown fit snugly in place too. They can last 2 decades with proper care. So, how do you choose the best option to restore a white, healthy smile? These options can range from fixing something on the surface to replacing an entire tooth or several of them. Each one of them has their own needs in terms of care to keep them looking great for a very long time. It all depends on how severe one's situation is and what the dentist recommends. Their goal is to ensure that everyone has a great smile, so it's best to listen to what they say. If you're looking for expert cosmetic dentistry in New York, contact our experienced team today. Aesthetics Dental Spa, based in Fort Washington, can help you get the smile that you want. The excellent staff will gladly answer any questions you may have and, after a thorough exam, guide you to the best option for your needs. Contact us today to make an appointment. Call us at 212-795-9675 or visit us online at aestheticsdentalspa.com.
Thank you for listening to the Aesthetic Dental Spa podcast. Your smile has a big impact on how you look and feel. That's why at Aesthetic Dental Spa, we continually help our patients enhance their image and their lives by transforming their smiles. Visit us in the heart of Washington Heights, New York City, and discover what we can do for you.